Hey, I'm Dr. SCL. I'm a dad, a chiropractor, and the translator you didn't know you needed in this, the first year of parenting. This is Decoded, the first year, the podcast that turns baby brain confusion, mum burnout, and milestone panic into clarity you can actually use. Let's make sense of the chaos by decoding it together. Welcome back to Decoded, the first year. I'm Dr. SCL, chiropractor, dad, and your guide through the chaos of baby development, nervous system overload, and milestone confusion. Today, we're going to tackle one of the most common and sadly the most casually dismissed concerns that I hear in practice. My baby just skipped crawling. That's okay, right? And look, it might be okay in the sense that there may be nothing pathological behind it, but it is always a sign worth decoding. So let's talk about what skipping crawling actually means and why it's not just one less stage in development. Now, before we get into crawling, its timing, importance, role that it plays in development, here is a scary fact. The CDC in the United States removed crawling from the list of developmental milestones because so many children in the US were not crawling appropriately, and they wanted to remove stress from healthcare providers and parents. Nothing to do with its importance in development, rather they wanted to compensate for external variables. Remember, common is not normal. So when is crawling appropriate? Answer: anywhere from 9 months onwards. It all starts with what we call the immature or 3-point crawl. In other words, the child will always have 3 points of contact with the ground, and it will mature to become the 2-point crawl, which is the one where they get really fast. Remember, walking is developmentally appropriate once the plantar grasp reflex has integrated, and that's anywhere from about 12 months onwards. So crawling is not just a cute thing. It's one of, if not the most important nervous system milestone in the first 12 months. You see, when your baby crawls, especially using a cross crawl pattern, in other words, opposite hand to opposite leg, they're doing a lot more than just moving. They're teaching their left and right brain hemispheres to communicate. The visual system is tracking everything from distance and depth. The core around the structures around the spine are stabilizing, therefore influencing posture. And the spine is rotating, adapting, and learning to move under load. In other words, they're learning to fight gravity. All of this lays the groundwork for things such as balance, coordination, hand-eye skills, and even reading and writing later on. So when a baby skips crawling altogether, we don't panic, but we do and must ask why. So the question is, why do some babies skip crawling? And there are a few reasons that I see all too often in the clinic. Number one is some form of compensatory mechanism. Sometimes babies will walk early, not because they're advanced, but because they're avoiding floor-based movements. They might not have the core stability and coordination or spinal flexibility for crawling, so they're smart and find a way around it. Secondly, is some form of spinal tension. A misalignment in the pelvis or lower back can make hands and knees activities unnecessarily difficult. So a baby might bum shuffle or bear crawl. This spinal tension can also be in the upper neck. You see, the postural requirements when in the traditional crawling position may be uncomfortable, so the baby prefers to be more vertical. And finally, the third reason why a baby may skip crawling could just simply be down to a sensory overload. Crawling gives a ton of input to the nervous system about left and right, top and bottom, front and back of the body. And if that system is dysregulated, the extra level of stimulation just might be too much. So the baby again is smart and will avoid it. Now, none of this makes your baby broken. It just we need to understand what's going on under the surface. So I'm always asked by every well-meaning parent, what can they do? And my answer will be something along the lines of, firstly, if your baby is happy and curious and exploring in their own unique way, great. But if they've skipped or modified crawling and you end up seeing things like poor core strength, which would be difficulty sitting unsupported. They've modified or they had a lack of rolling, especially from front to back. The sitting or transitioning from sitting to crawling or sitting to other postures. They have some form of unbalanced walking. In other words, they walk like the Tin Man, swinging same arm and same leg. Or you notice your child is clumsy and frequently falling over, or what we call toe walking. All of those warrant a closer look. Now, particularly what I'm always telling parents is home activities such as getting down on the floor with your child and crawling while playing is a massive influence. Why? Simple. Think monkey see, monkey do. So when I'm in the office and I do my full neurospinal assessment, I'm looking at the pelvis and spinal mobility. I'm assessing reflex integration, specifically reflexes such as the spinal galant reflex, the plantar grasp reflex, and the asymmetrical tonic neck reflex. I'm looking at general nervous system regulation, and I'm looking at things such as coordination and movement patterns. That's particularly between left and right, top and bottom, front and back of the body. And what we do is we then gently support what's missing so your body can integrate what they've skipped minus any pressure. So, is skipping crawling fine? Never. But sometimes it's what happens. However, all too often, what is necessary is just a little nudge from the nervous system to say, hey, something in here isn't quite feeling right. You don't need to stress, but you can get curious and ask questions and be engaged with your child's development. And that's what decoding development is all about. If this episode has helped you see crawling in a new light, send it to another parent you know whose baby is in a race to start walking. And remember, you can always find me on the socials at Mount Hawthorn Chiropractic, and I will be here to see you in the next episode. Dr. SCL, out. Thanks for listening to Decoded, the first year, where we translate the mess of early parenting into something that actually makes sense. Be sure to share this episode with a friend, a partner, or a mum that you know who is quietly struggling through the noise and secretly Googling every milestone. If you want to hear more decoding, follow at Mount Hawthorn Chiropractic on the socials. Let's keep decoding the chaos. No mansplaining, no pressure, no judgment, just clarity when you need it most. Please note, this podcast isn't medical advice. It's just smart strategies from a Gonstead chiropractor, a dad, and someone who's been in the room with hundreds of mums trying to make sense of their baby's development, their own postpartum recovery, and the constant noise that comes with modern parenting. Always chat with your health team for specific care.